Madaktari kuweza kujuza ni yapi ambayo yanajiri sasa hivi. Tutakuwa tunavuka huko moja kwa moja. Asanteni sana kwa muda wenu mtazamaji. Nimekuwa kwa Hadi ya Mwasiwa, wakati mwingine tena Mungu akiridhia inshallah.
If I conclude, you understand?
Yes. Please move closer. Everybody, just move closer.
Yeah.
Everybody move closer from the other side. Move closer.
I hope the height I'm not too tall. All right, good afternoon. Thank you for turning up. Like you've heard, we have had a good meeting with the union that represents the doctors, the dentists, and the pharmacists. We all know what is happening in this country for the last more than 3 weeks. It's a very unfortunate scenario which should not be allowed to happen in a civilized country. And what makes it very sad is that despite this happening and the suffering that the wananchi are going through, were people who are just thumping and throwing words and not trying to understand what exactly is going on. Actually, the bottom line is that we are fighting for healthcare in this country. The health sector is something that you cannot wish away. It is a very important sector in the country. It has to be respected. And like you've seen in some op-eds in the recent, it is a multifaceted sector. And we need people who understand it. Now, we are talking about moving towards universal health coverage. I don't understand how we want to go to this direction when we're actually playing around with the basic building block of the health sector. You cannot have universal health coverage if you don't respect the human resource for health. And it's important that you must understand that this human resource for health, it's a hierarchy kind of things. There are cadres that must work together. And if you talk about the doctors particularly, when you talk about interns, you cannot equate them with any other intern. These are people who have actually graduated after working for training for 6 or 7 years. They're actually going through that process that is now called internship with a temporary license from the registering body to allow them to build their skills so that they can become registered doctors. And if you visit any of the public hospitals, you'll find that the intern actually handles more than 60% of the workload. And it has to move from that level to the medical officer, to the specialist, and beyond that. So we cannot wish them away, and we cannot compare them with any other person. So it's very important that we understand how the health sector works. I said human resource for health is the most important, but we also have healthcare financing. We are certainly having challenges because we seem that the budget allocation to the health sector is being underplayed because people don't think it's important enough. We must provide enough finances to pay the human resource, to buy the supplies, and to build the requisite infrastructure. So as we talk about this, it will be important that we don't reduce it just to the issue of interns being posted. It has to be seen as a bigger picture that we are fighting, that the health sector must be addressed and things must be corrected in the right way so that when I go to work, I find that the environment facilitates me to deliver the services and so that we can take care of the wananchi. And it's very unfortunate because we must not ignore what is going on because public hospitals are supposedly for poor people. These poor people we are talking about are Kenyans. We have leadership that unfortunately can afford to go to private sector and go to abroad and all that, so they don't feel the pinch that the wananchi is feeling. And I must say, the sooner this thing stops, the better. But we must go back once we have actually worked out a proper roadmap as to how we're going to address the sector and continue addressing it so we don't keep on getting into crisis after crisis. Thank you very much. Thank you.
Good afternoon. Mine is to say that if we really care about our women there in the villages where we come from, we need to post doctors there to take care of our women from the village, our children, because what we are having, You have trained doctors who are not posted. You go to counties whereby for you to see a doctor, you must go to a level 4 hospital or come to Kenyatta. Number 2, people are being mismanaged because you are seen by a nurse, then a CEO. By the time somebody is seeing a medical officer, that person, if it was cancer, it is stage 4. And then you start having this life expectancy going down. I think it's the time we took healthcare as important as it should be. Yeah? We have over 100,000 teachers and police officers and everybody else. We can afford 50,000 doctors in this country. Thank you very much. Professor Dwega, University of Nairobi. Stanley Dwega. Yes.
A lady. A lady. I have 2 ladies. Just speak then. Thank you very much. I think. Okay, I'm Mondioyo from the University of Nairobi, Department of Medicine, working at Kenyatta National Hospital. I think this strike has come at the right time when this discussion also on healthcare financing. And I think, I hope that the country is going to utilize this opportunity to have a honest discussion and sort out the health sector once and for all. To begin with, the absence of the interns in the ward was already a fracture in the system because they are the basic unit from where we launch our patient management. Secondly, the strike that now has involved the medical officers and for the training institution, the registrars, it means that the consultant who is consulted by the medical officers and the registrars has no work. And therefore, to pretend that we are working when those who are supposed to consult us are not there is fallacious. And we are requesting that thirdly, you may look at the union officials as young, but all of us, old and young, are members of KMPDU. And therefore, the union officials usually speak for us and consult with us in what they say. And we are fully in support of the initiatives that they engage in to sort out the health sector. Finally, I hope that there'll be honest discussion between the governors, the governors and the Ministry of Health and all those who are involved for honest discussion, implementation of all the agreements that have been made in the past. CBA is supposed to be a document that is deposited in the courts, and it is not good to be contemptuous of courts, especially if you are in a position of leadership. Those who are in leadership always swear to govern according to the constitution and according to the laws of the land, and therefore, if they are contemptuous of the courts, it is a bad example for the country, and they're breeding anarchy in the country. We are supporting the CBA and would wish to see that the government fully implements the CBA, and the CBA also stipulates the role of the interns and how much the interns should be paid. And I hope that we are going to work speedily to implement the CBA, and because we are in the process of talking about another CBA while the old one is being trashed, I think this is not acceptable. We need to respect each other and respect the professionals, especially the medical professions.
KTN News.